Hello, and thank you very much for taking time out to meet with me today to go over the ideas of how to restructure the cardiac stress lab to be a little bit more effective. My name is Kimberly Gervais. I'm the non-invasive cardiology manager here at Brandon Regional Hospital, and I want to share my presentation with you. So just a moment and let me pull this up so you guys can see a little bit of my information here. Sorry. So, all right. Hopefully everybody can see that. And um, I apologize. So, here lately, our hospital, as you all know, we have been reevaluating a lot of our policies and procedures about how we are conducting our business and are we using all of our resources in a timely, effective manner. A lot of this is due to the Affordable Care Act, and it's setting new regulations onto the hospitals. One of them being the observation status patients. They now, and have been for a while, need to be discharged within 24 hours of the time that they are made the observation status. This puts us in a really big crunch time because there is not a lot of time to get multiple testing and results and have a patient discharged in a safe manner. And we have a lot of increased volume over the past couple of years, leading to some staffing shortages. Patient volume has increased about 10% over the prior year, and we have about 5 new cardiologists on our medical staff. Many of these are individual practitioners, which make it a challenge for our cardiac stress lab to accommodate them with the current hours of operation, because they don't have partners that can come in and perform the stress tests. So they would like us to open earlier so they can have them done before they go to their clinic to see patients. So we do have a limited schedule for our physicians. And then we don't have enough staff to increase, for the increased volume to accommodate all of the demanding needs. Recommendations, we would like to eliminate the full-time EKG position. Maddie Figueroa has just retired. She's been in that position for 20 years. She just retired, so we're looking at her position and trying to restructure it to better accommodate the skill sets that we're needing. So we'd like to create the cardiac technician position in place of the EKG position to fulfill the FTE. We want to change the cardiac stress lab hours of operation to accommodate our physicians and hopefully get our observation status patients into the lab earlier to help in the process of discharging them on time. And we need our floor nurses or certified nursing assistants to start doing EKGs, the stat EKGs on the floor. The routine EKGs will be done by the cardiac technician. A few differences between EKG and cardiac tech is basically the cardiac technician just performs a lot more testing. They can do EKGs, they can do the stress testing, download the Holter monitors, which can actually take a couple of hours out of the stress nurse's day. They have to go beat by beat and look in a 24-hour Holter monitor. So that will really free up the stress nurse. They have multiple certifications. They have administrative duty that they will perform, and especially in our MUSE. MUSE is the electronic medical record system for our EKGs. All EKGs need to be confirmed within 24 hours, so this will be really good that the technician will have her hands on that. We'll have a full usage of the FTE, and there is a little bit of pay difference, but it's very well compensated with the all the skill sets that this position will hold. EKG position currently is only performing on an average of 8 EKGs a day. which only take approximately 10 minutes to perform. So that is not a lot of productive time. Um, she does do some of the administrative work, which is really fixing EKGs that the emergency department performs, and fixing the stuff so the physicians can read it as far as medical record numbers, account numbers, and that does add up to about 3 hours a day. So there is a lot of wiggle room. There is room for physicians to also help the stress lab and do EKGs and use responsibilities. The cardiac technician, they what I like here is that they do have certifications. They'll be a certified cardiographic technician. The CCT is through the Cardiovascular Credentialing International, and they are just credentialed to do a lot more. They know rhythms, heart rhythms, irregular heart rhythms, to help identify change in patient status, which is important when we're monitoring our stress patients. Again, our median hourly rate comparison, which yes, the EKG tech makes less money, but we're also adding a stress tech to our daily routine onto our schedule. So we are scheduling 4 people in the stress lab on a daily basis when our productivity only allows 3. We have 3 FTEs, which are 2 RNs and 1 EKG, and we've been adding on a stress tech PRN. And we have been running at a negative productivity rate because we cannot keep up. We just can't keep up, and our productivity does not, our units of service do not allow for the extra employee to be on staff. The benefits of the restructure, we're going to improve the stress lab workflow. We will, we have already increased our productivity because we have done a 3-week trial so far with this position since Maddie retired. Tara Lee McCabe has been doing the EKG and stress lab responsibilities along with the Muse super user, and she's accommodating it very well. She enjoys the job, and she is utilizing her full 8 hours very appropriately, and we have increased our productivity with this trial run that we've been doing. Here you can see we have less man hours that we're using. Our units of service daily have increased. Our productivity hours used to be negative. We just could not keep up with that extra technician on staff, and our monthly percentage has gone up. So just within 3 weeks, we've already fixed the negative productive hours that we have been struggling with for quite some time. The challenges are going to be enforcing the new policy for the stat EKGs to be done on the floors. They're currently doing the stat EKGs after the EKG tech goes home between 3:30 p.m. to 6 a.m. So they will just need to do the stat EKGs 24 hours a day. And if they're properly monitoring their patient, they're going to want to know what's going on with their patients. And stat EKGs are normally ordered on patients with a declining condition. So it's going to offer a little bit better service, better results, faster results for the patient, and hopefully better outcomes. And we need to get human resources to be able to create this position and give it a fair, competitive rate with some of our neighboring hospitals to make it really worthwhile for the person who is going to be very busy running, doing a lot of this work and holding these certifications for us. And in the end, we really hopefully will reduce our observation hours. And this is going to be done because this position can offer assistance to the stress lab and also to the EKGs, but it will allow for us to be able to get the observation patients in to the stress lab earlier if we can change the hours of operation to help accommodate the physicians. And it's going to reduce the workload on the nurses because they also share their time with the echo lab, helping with some of the conscious sedation procedures that they do over there. So they actually work in the stress lab and have to float over to another department to help support them as well. So the cardiac tech will help support the RN who's in the stress lab, while the other RN is in the echo lab. And hopefully it'll improve employee satisfaction just by a better workflow, giving some growth and development opportunities, and hopefully patient satisfaction, physician satisfaction as well. We have some references here, backed up by some of the credentialing societies, and I did interview some of the employees. So let me come back to you guys. And I want to thank all of you. There I am. Where am I? I want to thank all of you for listening to me today. And if you have questions, please call me at extension 6031. We're going to continue throughout this trial period that we're doing, continue working on the productivity. I'm hoping HR, Human Resources, can come up with a rightful pay so we can offer a position to somebody that is well deserving of this and our staff and our positions. So I'm looking forward to this opportunity. And thank you for your time.